Now I can see who is going to join us. Okay. I usually just wait a few minutes. So,
Okay.
yes. Okay. We have some people coming in. Excellent. Hi. You can let me know who has joined. I know somebody said last week that they want a prize for being the first one. Is that person on? Okay. If you're on, just let me know. I can call you out, but I won't call you out. I am hearing myself in the background. So, okay. So I don't, like I said last week, I like to start on time. 2 minutes, I'll give 2 more minutes because my guest, I'm sure her time is of great value. So just 2 more minutes and we will get started. I wouldn't even wait until 8:05. 8:04, we're going to start the show. So, hey, everybody who's on. No one's telling me who's on yet. I'm looking and I'm not seeing. I Let me tell you, I could be looking at the wrong place. Anyway, hopefully they'll get started when we get started. 8:03. 1 more minute. I need to see a name. All right. So we're going to get started. Good night, everyone. Good night, good night, good night. Welcome to Banter with Bev. I'm your host, Beverly R. Williams, and I'm just so excited. I'm just so excited. I know, let me get myself in this screen before hubby comes up and say, get in the middle. So I'm so excited to have you all here with me. And tonight I am super excited to be joined by my special guest, Dr. Lisa. Good night, Dr. Lisa. Welcome.
Thank you. Thank you for having me.
Yes, it's great to have you here with us. Um, so tonight is a special night. Tonight is I've been talking about it all week because last year I had my first virtual event. Be Will
Mhm.
Inspires had their first virtual event, mental health event, and it was a 2 day event, and it was called Unveiling Naked Truths. And
Mhm.
so I thought this year, I'm like, okay, should we have it? Should we not have it? And then I'm like, why not? Mental health is still important. The issues still need to be discussed. And I like having it at the end of the month because when the month ends, the stress continues, the
That's true.
escalating prices continues, and everything else continues. So I'm like, let's have it at the end of the month so that people don't forget the mental health awareness or their status of their mental health. So um let me see. I'm gonna check my notes again. And okay, yes, I'm gonna be checking my notes a little bit. And so last year the emphasis for the Unveiling Naked Truths about mental health was trying to get us from stigmatized to normalize, just trying to move that discussion along. And we had four last year, we had four powerful testimonies or personal experiences, and people shared their personal experiences. And for those who missed it last year, you can still find um, the recordings on YouTube at Be Will Inspires. But this year, now listen, listen, listen. As I was preparing for this year, I said, so we went from stigmatized to normalized. And I don't know, there's a quote or a saying that I came across, and it says mental health is serious. And I don't know if anybody has heard that, but I'm like, So let's talk about how mental health is serious, but I wanted to put a twist. And I said to hubby, I say, I want to make mental health sexy. I know. I know. I said I want to make it sexy. And he was like, oh, okay. So here, I see I got my gas. Hey, so I got my gas. Like, okay, let's see where she's going with this. So this is what I thought. I thought, okay, we know it's serious business, and
Mhm.
that's what we'll talk about tonight. And by saying sexy, I don't mean to minimalize it at all. What I mean is, there are some jobs. Now, I'm not going to I know I may get in a little trouble, but there are
Mhm.
some jobs that people say, oh, that's not the sexiest job. Or, so in the informal sense of the word sexy, like, okay, that job is dull or boring. Now, that somebody may call being a lawyer dull or
Yes.
boring. Somebody may say being a physician. I don't know, just depends. So I'm saying in that context, when we talk about sexy, dull, and boring, I'm like, let's talk about mental health, how exciting it is, how yes, it's sexy, it's exciting, it's layered, it's in, and I was just getting all excited talking about it. And I'm like, so I'm going to talk about how we're going to go from last year stigmatized to normalized, and this year we're going to talk about serious and sexy. Now, we're not going to stay on that too long, but I just wanted to get people's attention so that they can
Mhm.
see that it is just the most beautiful thing to talk about, and not just during the month of May. So now that I have said that, now that I've talked and stimulated some people's minds, I want to introduce our special guest. Now I definitely got to go to my notes for this. So, Dr. Lisa Henderson Greene. Now, first of all, if you've watched me for the past month, we've been having awesome, powerful, strong movers and shakers. Well, she is a mover and shaker in the field of mental health. Here we go. She is a native of the beautiful country of Bermuda. Yes, she's a native. So if anybody from Bermuda is on, you can say hey. So she's a native of the beautiful country of Bermuda. She's a licensed, excuse me, clinical psychologist and a no, yes, and a therapist. And she has practiced for more than 20 years in the DMV area. Now, for those who don't know what the DMV area is, uh, District of Columbia, Washington, D.C., Maryland, and Virginia. Hubby and I lived in that area for 6 years. And in fact, Dr. Lisa and myself, not only do we share, well, I'm not from Bermuda, but I've been with I've been with hubby for so long, it's just like I'm from Bermuda. So not only do we share Bermuda, but we also have the same alma mater, George Washington University. So she is currently the senior psychologist at Kaiser Permanente Largo of Greens, excuse me, Largo Medical Center, Behavioral Health Department. And she is also the founder of Green Springs Psychological and Consulting Services. And over the years, she's worked in so many capacities in the area of mental health, including the school system. She's worked in community medical centers, the prison system, psychiatric hospitals, private practice, where she provides individual and group therapy and psychological assessment. So, we got somebody sitting in the seat who knows her stuff. Now, before Yes, who knows her stuff? So I'm going to take a break, catch myself. Now, y'all see she has on her glasses. She has sense. My glasses got broken, and I'm trying to play cute. That's why you hear me stumbling. But anyway, I want Dr. Lisa, I will call her Dr. Lisa for the rest of the night. I want Dr. Lisa to tell us some more about her. Tell us the personal side or her passions. You take over.
So, good evening, and thank you for that warm introduction. I am grateful. When you hear about yourself, it's like, whoa, I did that. I did that. My goodness, I'm old.
No,
I'm
you're
old.
not.
But thank you. And again, thank you for inviting me on this evening's show and just your second annual um, visiting of mental health, which is so key. And like you said, it can be sexy when you think about mental health because you're investing in yourself. And when you
Mm,
invest in yourself, you want to think of yourself in a certain way to kind of spark the energy, spark the motivation to get yourself where you need to be your best self. But
absolutely.
hello, everyone. Again, thank you for joining. And my hope is that you're able to take something away from this evening's conversation for it to be a relaxed and inviting conversation, as Beverly shared, and that maybe you can get a nugget or two from our chat this evening, something new or something you need to be reminded of. I know all of us are coming into this platform at different places emotionally, physically, mentally. And, when we think about just the mental health component, that is a critical piece of where we are and who we are. And it definitely impacts other layers of our lives. So I'm excited for this conversation. I really am. But a little personal side about me, I think you shared some of the key points. I'm in the DMV. I'm
Yes.
from Bermuda, so I have that, the islands love forever. And of course, being in the DMV, I'm in the DMV. I enjoy being in the DMV. I am married, 22 years, so I have some knowledge there a little bit, and then two teen boys, so they definitely keep me busy. So my passions right now are raising two healthy men of color. And in this generation, we've gone through so much, not only as a culture, as a BIPOC population, but just raising your boys, that's hard work. And so that's really my passion right now, just kind of focusing on that, raising boys of color, and just kind of giving them what they need to be equipped for the world that we live in, that's ever evolving, but also comes back to some core things that have plagued us for centuries with our black males. So that's my passion right now, but I also enjoy working with the children. I enjoy working with the adults. You can see just how through development, just starting at that young age, how personality develops, how character develops, how behaviors develop, and just how they impact you along the way in adulthood. And if you don't get it right somewhere along that timeline, you can come back and get stuck as an adult in those certain areas. So it's always interesting to me and a passion to just work with the children, work with women, just in general, just wanting whatever population I work with to thrive and not just survive. And we know that it has to start with you being healthy. If you're not healthy, you can't be healthy for anyone else. So,
Absolutely.
mhm,
Absolutely. Wow. And the thing is, so like I said, we share a lot in common. And one of your passions, like you said, children, same here with having three. Mine may
mhm,
be, mine are a little older than yours, but I do have a teen son. So when you said for our black males, our young boys or young men,
mhm,
I'm like, okay, so we share another thing.
mhm.
So, so this is going to be exciting. Now, let's go. Let's go.
Let's go.
Um, so last year, like I said, unveiling naked truths.
Mhm,
uh, I don't even know. I think the reason why I termed it that last year was because I think there's so much about mental health that is still shrouded, that is still uh, covered, or not seen as it should be. And so uh, I want you, the first question, what are some things that you feel as individuals that we need to know about mental health, but we don't know? And then what are some things that we think we know, but we think we know? Because I know a lot of people think they got it. They know. In fact, a lot of people probably saw the these flyers, and
mhm.
they're like, I'm good. I don't need that. But what are some things that we need to know yet we don't know? And what are some things we think we know, but that we may have a big misconception about what we think we know? And it could just be one thing. Like, what is the biggest misconception about mental health? Or what is the biggest thing that you would like for us to know about mental health?
That is so layered and it can go in so many different directions. But I think the first thing that kind of came to mind is that I'm not crazy. When people hear about mental health and or mental illness, and the terms can be used interchangeably, but they mean different things. And we can tease that out as we talk.
Yes.
But when you hear mental, automatically there's that stigma like, okay, I'm not crazy. or
Mm,
that's not me. But in fact, mental health is important because all of us have mental health issues as far as wanting to self-care and just be the best self that you can be. Mental illness, that's looking at clinical diagnosing and disorders. So all of us are impacted and have maybe someone that is impacted by a mental health problem, or ourselves have a mental health problem. And if you have someone that's impacted with a mental health problem, you are living that too with that person, because it affects you. It trickles down. It's a spiraling. It doesn't just stay in that pocket. If you have it yourself, you have to deal with that every day. So it is a problem that affects everyone. If you have a
mm,
mental health disorder, a mental illness, however you term it, but it is a problem, and it's a big problem, and it gets minimized because we have so many negative connotations towards mental health that stem from just our core beliefs and what others in our cultural or family believe about mental health. In some cultures, like, we just keep it to ourselves, we don't talk about it. In some cultures, like, oh, there's a shame associated. So we kind of put all of these layers on mental health issues and illness that we lose sight of the fact that this person needs help. The same way
mm.
you go to the doctor for a problem to kind of, I have earache, or, I cut myself, I need, something's wrong with me. It's the same way when you need to think about your emotional well-being. It's the same thing. Like, something doesn't feel right, something is off. Let me get to a mental health professional who can help me figure out what's going on, and not just kind of stay stuck feeling that, okay, something is wrong, but I don't know what it is, but I'm not getting help for it. It's okay not to be okay, but it's not okay to be stuck and not get the support and help that you need. And if you don't know how to get it, then start asking those questions. So it's really a vulnerable thing when you have these questions regarding your own mental health.
Wow. Awesome. You said something when you talked about uh well, first of all, there's, like you said, it's layered. It's layered. As you were talking, I immediately thought about how you talked about uh the young boys,
Mhm.
and how that's your passion. And I thought about, even like when you say, I guess, how people don't want to be labeled as crazy. Um, and I'm going to link it with young boys, your passion, and just people loosely use terms like crazy.
Mhm.
People, I hear people even loosely use terms of um like, oh, I'm depressed, or or she's bipolar, just very loosely without any diagnosis. Um, I guess my question would be, what well, I guess you already answered that by saying, if you feel like you're stuck, go and go to the professionals who can guide you in terms of getting unstuck. I guess I'm spinning around. Let me go
Mhm.
back to young boys who maybe, I think about young boys who are in school, and they may be labeled as rude, or they may be labeled as slow. And not just young boys, even young girls.
Mhm.
Um, so, what would you say about these labels? Could that be? I know we're coming to a time where we're evolving in mental health, especially now in the Caribbean. And so they hear more of learning disabilities and learning differences. How can learning differences and learning disabilities help or hinder one in terms of their progression in school, in terms of their, because I know learning disabilities and anyway, let me stop there. Was I clear, or maybe not?
There was a lot there. So let
Yeah.
me let me tease some things out first.
Yes.
So let's get clear with mental health and mental illness and
Yes.
defining that. So when we think
Okay.
about mental health, we're referring to anyone's state of mental, emotional well-being. So it's anyone's mental, emotional well-being. When we think of mental illness or mental disorder, we're thinking about a diagnosed condition that affects your thoughts and your behaviors. Now you're talking about learning differences and learning disabilities. So you're looking at starting really when we're looking at young kids. Yes, it can be diagnosed at any time, but usually we kind of when a school age child enters school, you notice these things more because it's brought to your attention by the teachers or by instructors, whether they're homeschooled or in a school setting. And it's important to really flush it out because I find sometimes that teachers, parents, clinicians can just throw out labels and names, as you say, and it may not be the right diagnosis. It may not be the right term for that child. And while we're throwing things out, we're not realizing the impact, especially if we're saying it in front of the child, depending on the child's age, what emotional impact that may have on a child as well. I think let's look at ADHD, for example. I think we're so quick to label a child as ADHD,
Mm-hmm.
saying, oh, they can't keep still, they can't focus, something's wrong with them, they have ADHD. Little Johnny is just not doing their work. Well, we have to take some other things into consideration if we're looking at it from that perspective. Okay, how old is little Johnny? Okay, let's say he's what, 7. Okay, how big is little Johnny's class? You know, if it's 30 kids in the class, is it 12 kids in the class? How's the teacher's instruction? Do we know what's going on in little Johnny's home life that may be distracting him from being productive in class? Are we seeing little Johnny's symptoms as far as being able to focus or not focus in multiple settings? What else is going on with little Johnny? Now, little Johnny may be different from little Sarah because boys and girls present differently in the classroom. Little Sarah can sit quietly and do her work, but little Johnny's a boy. He needs a little more movement. He can't keep still. So comparing little Johnny to little Sarah, well, he can't keep still. He's just all over the place. So you got to take away and be some of those things that we just throw out there and really allow yourself to investigate what is going on with this young child. If it's really ADHD, let's diagnose this and use screeners, let's use assessments to really figure that out. If it's not, or if there's something else going on, let's look, but not let's kind of narrow it down and say, oh, it's just this without looking at the big picture because
Yeah.
there's so many things that kind of come into play here. What I also find is that for many, whether it be a parent or just an adult or teenager, we use the internet a lot to be our psychologists, our therapists,
Mm-hmm.
to figure out what's going on with us. And yes, there's a lot of knowledge out there, but you have to be able to use it the right way because it's so easy to look at a disorder, to look at a condition and go down all the symptoms and say, wow, that's me, that's me, that's me. And then, hey, all of a sudden I have ADHD, or hey, all of a sudden I have whatever the disorder is. So we need to be able to use our own situation where we are and be investigative and looking at what's going on with this child, what's going on with myself that could be impacting what's going on in the situation before I label a child as having a disability, before I label that child as having whatever that may be. And then we also need to we need to use in the right way the research that we're doing to kind of say, okay, well, I did this research. It sounds like it, but I want to at least kind of
Further.
have a sounding board to say,
Yes.
is this accurate or not? So we need to use the knowledge that we're gaining in the right way. And if we don't know what it is, we can kind of spin out of control, as you say, and be going down some paths that may be self destructive for the child or for the adult, whatever the condition may be.
Awesome. Awesome. We have two questions. I wanted to ask you. Yeah, I am glad you said for the adult as well, because I know sometimes, and I see the questions coming in, and I will get to it, audience. But I do. So if there's a diagnosis, a lot of times, so I know of people who get a diagnosis and they don't do anything with it, like you say. Yes, or they just hold, they're like, okay, I have this, and that is it. And there are some who run away from even going in to get the diagnosis. If there is a person who suspects that they have a mental health challenge,
Mhm.
um, if there's nothing done, would that progress into adulthood usually, or can people grow out of, like how we were talking about ADHD? Can people just grow out of, you know, a mental health disorder like ADHD? And then I will get to the questions.
That's no, you can't outgrow ADHD. ADHD is really a medical condition because it affects the frontal lobe of
Hmm.
the brain. You're
Hmm.
you're processing, your thinking, and all the decision making there. So you may feel you outgrow it, but no, what you've really done is you develop the skills to mask it or master it better and label it and push it off as something else as opposed to what it truly is. So you'll
Okay.
find there are a lot of adults that are getting diagnosed with adult ADHD where, oh, I may have just been forgetful as a young boy or a young girl, or, yeah, some excuse as to why they may not have been as productive, younger than they are now. And what you find is that as an older person, you figure out strategies and ways to compensate for your deficits
Okay.
in certain
Excellent.
areas.
Excellent.
Hmm.
So let's go to some of the questions. NPD is affecting our community. I'm not sure. Do you know what that is, Dr. Lisa?
NPD.
PD. So if the person could just, Edison, if you can just clarify, I'll go on to some other questions. But another question, so just clarify what NPD is for us so I can be clear. Um, okay, two questions about how long is the average diagnosis process? How long is the average diagnosis process, and how heavily is the biological aspect of the brain and the body incorporated into clinical psychology in comparison to the behavioral aspect? So let me just let's see with the first question. How long is the average diagnosis process? And
It
I guess
depends on it
kids.
depends on what we're diagnosing. It
Yes.
depends. For some, if you go to a clinical psychologist or a licensed therapist or social worker or psychiatrist, having a good in-depth clinical assessments as far as just an intake to kind of look at developmentally when some of these symptoms started to present, because we
Yeah.
look at timelines and different symptoms, and you have a number of symptoms that kind of present with a certain diagnosis, then it can be our clinical judgment that kind of guides that. Some things are just very clear and off the bat, it's this. For some, we may need to kind of dig a little deeper because you find that there are some conditions, some illnesses that mimic other illnesses. So you want to flush it out to see if it's really a true diagnosis of what this illness is, or if it's a comorbid where it's presenting with another, that you have both, or if it's not, then what else is it? If we need diagnostic clarification and we don't know what it really is based on, just the patient sharing what their symptoms are, and we don't want to just throw out a label unnecessarily, then we do some psychological assessment where we do some emotional testing or cognitive testing to see, okay, do these symptoms or does this presentation of how this person is presenting, if we can't get a clear diagnosis, what is the data showing? What are these standardized measures telling us about that person? Whether it be a personality assessment, whether it be a cognitive assessment, whether it be, educational assessment, what is it telling us about that person? And then you can kind of get a clear, concrete answer. But for most cases, if you have a session, a good intake with a clinician, and then you have a quote unquote working diagnosis, I think it falls under this. And as we work together, we can flush it out more, then we can fine tune and tweak it. Maybe in that first session, you can get a clear cut. Maybe it takes a couple of sessions, or maybe it may take a psychological evaluation to kind of give you a clear cut diagnosis.
Okay. Makes
Does
sense.
that make sense?
It makes sense. It actually it does. Let me go to, you talk about personality. There's another question. What is the difference between mental health illness? I'm not sure if they mean mental health, mental illness, but they said mental health illness and a personality disorder. Can they both be treated? So,
So
mhm.
we there are medications that can treat some general mental health illnesses. When we look at the more of the personality disorders, we're looking at more characterological base, which is a little harder to treat. Yes, medication can help, but it's more characterological, so it's kind of dealing with some deeper level personality
Hmm.
characteristics, which takes more talk therapy to kind of really help that person through some of those situations. So you may not see as much of progress with someone that has what we would call the old school axes 2 type diagnosis, those personality disorders. Whereas if you have just an illness which you can kind of self correct a little bit with some of the medication,
Mm.
then that may help in that way. But at the end of the day, you find that it's a little harder to treat, like if the a borderline personality disorder or a narcissistic personality disorder or the schizophrenia. Yes, you can manage some of those behaviors that may be a little more glaring, and you need to rein in some of the anger or some of those other layers that are there, but it's more characterological, and you have to take more of a supportive, more long-term approach with some of those disorders.
Awesome. And that kind of follows the question that was first asked, NPD. Um,
So is he talking about narcissistic personality
narcissistic,
disorder?
yes, narcissistic personality disorder. So they're saying it's affecting our community. That it was just a statement. So I guess they're just making a statement that it's maybe more prevalent now. I'm not sure. The statement was made, NPD is affecting our community. So let me get back to um, some more
And
questions.
do people know what narcissistic personality disorder is? It's basically
I
a
don't,
disorder in which the person
that's
has an
true.
inflated sense of self and self-importance, kind
An
of.
inflated sense of self and self-importance.
Hmm.
Okay. And so now that's interesting because nearly everybody, I guess, has a touch. So how can you, no, for real, a lot of people have ego problems. So
Hmm.
how do we decipher and say, well, this person with ego problems is not someone with NPD? I mean, classified as NPD, or is the line very thin? And sometimes we can't even distinguish the difference with just someone who has a huge ego and then someone who really has this personality disorder.
So, what guides our diagnosing is the Diagnostic Statistical Manual of Mental Disorders, the DSM. And so, there are criteria that we look at when we're diagnosing a person. And, you know, we will go to that diagnosis and we'll look at the criteria that has been, put aside for that particular disorder. And if the person meets certain criteria, then we kind of go with the diagnosis.
Okay, got you.
So that's how we guide some of our diagnosing if it meets the criteria.
So again, we can't just go around pointing and say, oh, that person has NPD, or, a lot of people like to self-diagnose, but there's a specific guideline, the what did you just say it was again?
DSM, we're on
Yes.
the DSM-5 now, the fifth version of it. So, Diagnostic Statistical Manual of Mental Disorders. So we do use that as our governing body to kind of look and see, do they have these symptoms? Does it match up with what is required to meet that criteria for that diagnosis? Yes, we can off the cuff say, wow, that person, they're feeling themselves a little bit, or that person is narcissistic just because of the way they present and the way they come across. And maybe it may be true, maybe it may not be true, but we don't know. Again, we don't know what else is going on, because some people may overcompensate for deficits they have in their personality by coming across as being a certain way. And
Mm,
so it's good to kind of at least know a good history on people, to
mm.
get a good history when you're looking at diagnosing, because that way you can flesh it out and see exactly what's going on and what is or isn't present.
And I guess that speaks to what you said earlier. It may take one or two visit. There's no set time to get that history on an individual. Um, is NPD presenting with specific problems interacting with others? Okay, is NPD
You know,
presenting with?
what
Mhm.
I'm hearing is, okay, now we're getting into some other layers here, but what I'm hearing is MPD, inflated self-esteem or inflated personality. Got to be careful, because sometimes there are some other disorders that can present that way. If you have someone that may be on the spectrum, autism
Mm,
spectrum disorder, they can come across as that way, in a sense, just kind of not really taking into considerations others' feelings or being able to relate to what they're going through because of just what that disorder and presentation of it is. So yes, there are some clear narcissistic people, but you don't know if that's just a blanket statement you can put for everyone, because there are so many other disorders out there that can mimic or kind of come across as that diagnosis.
that makes sense what you just said, and that's exactly what I was saying earlier. it's just so exciting, this whole mental health field. There are so many layers and there are crossovers, but um, there are also clear lines and that define. Somebody is saying this is powerful, awesome. I'm sure they're talking about your information. So hallelujah. Here we go.
But,
Let
but
me.
Beverly, this also makes it clear that if you have questions about what's going on with somebody and they don't seem quote unquote right by you, or functioning in a certain way, then it's like, well, maybe they should be encouraged to at least get it checked out, because there are so many people walking
Exactly.
around with things that they don't even know they have, or come across with things that they're not even sure about. So
That is
it's
that
important.
is it is extremely important. In fact, last week, my daughter and I, our banter with Bev was more of a laid back, you know, kind of, I called it free flow convo. But we were talking about blooming and being great.
Hmm.
And when it comes to this conversation, I guess my question would be, I told them last week that if they come, I would ask you the question: how could an unhealed wound or an unaddressed trauma impact someone from blooming and being great? And I guess the unaddressed trauma, it can is that what would that fall under? Would that fall under, yes, would that fall under a mental health disorder, illness? Is it just a crisis? Yeah, and maybe you need to define them. And then I know I always layer these questions.
You do layer them. There's so
I
many layers there
sorry.
because
You
trauma.
choose whichever one you want to. I'm sorry.
That's okay. So trauma, it can be definitely something that stunts someone emotionally. And for some people, let's say they may experience an early trauma. Trauma could be emotional, physical, sexual abuse. It could be a life-threatening situation. It could be so many different things. So again, it's individual to
Yes,
what the person's experiences, and understanding what that experience was, when it happened, if it was at a defining time in a child's life, during attachment, if it was a defining time through their development, was it through a relationship that was happening, because depending on what the circumstances are, can definitely help guide as to how that person will react. For example, if someone may have been sexually abused when they were younger, they may have relationship issues, clearly, as they get older. And as they get older, they may have, when they're younger, been able to push it aside and, try to get through life. But then they get stuck as a teenager or an adult, saying, why can't I do certain things in relationships, or why do I get stuck here in a relationship, why can't I connect? Then you take it back. Okay, well, this trauma happened to you back then. Clear
mm,
example, when we look at all of our well, it's Memorial Day, so for all of our troops and all of our service officers, when they're serving in some foreign country, or when they're serving in a war torn country, those experiences, they have traumas that they carry with them, and they relive and reenact in dreams or in distressing situations that kind of take them back to that. So a PTSD, a post-traumatic stress reaction to that. When we have an immediate trauma or immediate situation that makes us feel threatened, we experience an acute stress situation. So an acute stress disorder kind of situation.
yeah.
It impacted me. This happened. When it lingers longer and it carries over into affecting our day-to-day functioning, and we can't get past it, we keep reliving it in our dreams, in our thoughts, in our activities. We get emotionally distressed by it, and it carries on for months and months. Then we kind of shift it over into more of a post-traumatic stress disorder, because it's triggered by certain things. When we
Mm,
look at illnesses and disorders, we look at them on a timeline continuum. We look at the length of time you experience it. How long has it been going on? And that kind of gives us the level of intensity, as well as duration, as well as what category to properly assess you to be in, as when we look at treatment planning and how to help you with that. So
okay.
traumas do stunt you emotionally. You'll
Okay.
find that depending on what it is, like I said, you may find yourself, I'm stuck, and you wonder why. And when you kind of go back and do that introspection, whether you do it yourself or you do it with the help of a therapist, then you realize, aha, it was at that age that I keep going back to because I did not resolve that issue. I didn't get proper closure. I didn't get the proper coping skills or the strategies I needed to kind of help me through that. And now I need to work through it because I'm stuck
Excellent.
emotionally.
Excellent. So when one finds out that they're stuck emotionally, or just, you know, and just as an adult, like you set goals for yourself and you can't reach them,
Hmm.
um, what who should they, in terms of, because the mental health field is a vast field. We have the psychologist, the psychiatrist, the counselor, the therapist. How does one choose? How does one say, so let's say, okay, I know I need help. How do I decide which one do I go to?
So for some, if for some people, it could be going to their primary care physician first,
Hmm.
because you may find that sometimes, in many cases, emotional illnesses can present with physiological presentations.
Hmm.
And what happens is that we try to rule out any medical basis for something first before we kind of label it as a emotional issue.
Now,
So
when
for,
you say emotional, you can I say, I can I interchange that with psychological? Just asking.
you can say a psychological, you can say, yes, we can say a mental illness or psychological
Okay.
or behavioral health issue.
Okay.
We can say that.
Okay.
So for some, like, case in point, someone is feeling anxious, someone's having a panic attack, they feel their heart beating faster, they feel chest pains like they're choking, they feel like I can't breathe, they may think they're having a heart attack, or they may think they're having a stroke, or they may
Mhm.
think something else is going on, that thumping just won't go away. But if we remove all the physical components and say,
Mhm.
okay, no, you're fine, your heart's this is that, okay, then what else could it be? Because I feel like I'm dying, I feel like I can't,
Mhm.
I got nausea, I've got this going on. Okay, well, then let's look at anxiety, because
Mhm.
anxiety can cause your body to have a physiological reaction like that. So then your primary care physician will say, well, I think you should go talk to somebody. And they may recommend go talk to a therapist. And
Mhm.
that could be your first way to go to finding help. For someone else that does not take the route of going to the primary care physician, it's like, okay, I need help. You look at your insurance and say, okay, is there recommended or under my plan, are there specific people that I need to go to? Let me do that. Let me see who's on the panels. Let me try to reach out that way. If
Okay.
that's not something that you want to do, then you kind of ask a friend. Ask, if you're a faith-based person, ask your minister. There
Excellent.
are ways to do that. If Or just kind of old school, well, we would use the phone book, but new school, go on the internet and pull up a therapist or a psychologist in my area, and then you can get some background that way. And then you would always have your first consultation and intake so that you can talk about and see what the concerns are and if it would be a good fit and if it's something that they can help you with.
Excellent.
So that's how
Um,
you do it. Now, psychologists and psychiatry, maybe we need to define that as well.
exactly. And counselor and therapist. Just, I know you can't do it all, but just little quick, the differences.
Okay, so really it's degrees, how much education you had.
Mhm.
Psychiatrists think medicine, because a psychiatrist is really a medical doctor that has specialized in the area of behavioral health issues. So they have a medical degree. Psychologists, we don't have a medical degree, even though there are some courses that we can take to prescribe. But in general, when you think of a psychologist, we've studied behavior, emotions, and other factors and are able to give, a diagnosis to a person presenting with whatever symptoms. Psychiatrists can do the same thing.
Yes.
But the only thing that separates us is that they can prescribe medication and they have a medical degree.
Yes. Okay.
Now, a counselor, when you think of counselor, we think of not a PhD or MD level. You're thinking more of a master's level or a bachelor's level, depending on the program you're in, and it's specific to the program. But with anyone, you want to make sure that they're licensed in whatever discipline that you're going to, and in whatever state that they or country or island that they're in, that they're licensed.
Excellent.
Because
Um,
if you're licensed, that means you are adhering to the ethics and the code of conduct in your profession for that country and state that you're in.
and certification, is
And
that
certification, yes.
okay?
Hmm.
Excellent. Here's another question. Is there a cure for behaviors such as pedophilia and sociopath or delinquency? If not, how would a psychologist treat? Hmm. That's a good one.
Well, that's a heavy one there. With with the sociopath and with the pedophilia, you have to separate the person from the behavior, and
Mm,
you have to go back and look at behaviorally what went wrong in that person's life. For pedophilia, were they sexually abused? And so now are they recreating the environment that they know? What is going on in that person's life to kind of have triggered that in them. Um, and that I don't think that there's enough time to really dig more into that particular
okay,
topic in this time frame that we have, because it is a very
layered.
layered, as I think that's my word for the night, layered. um, but as far as the treatment, there are treatments where it takes a lot of intense therapy. It has to take a lot of intense introspection with the person, and really unpacking what went wrong and trying to change that behavior. And it's hard because some of that is so innate and inborn in them that it's hard to change it. And so you see a lot of repeat
Mm,
situations in that case. With psychopathy, you're removing the emotional piece from it. They have no sense of the emotion is removed. It's just a dark space that they're in, and we think of that psychopathy more so on that those characterological layer of looking at how we treat that it's again intensive therapy, intensive work, and trying to really help that person see some of the issues, some of the lack of empathy, some of that um, dullness and the presence, the lack of, and their behaviors as something wrong. And it's hard because again it's that characterological baseline, and these two areas are really more time needs to be given to really dig
okay,
deeper into those things. Mhm.
no, no problem. I
But
think
there are treatments, and there are intensive treatments, and
is it more so talk therapy? Is that what I'm hearing more so than medication,
I
or
think
is it
it's
a
a
combination?
combination of both.
Mm-hmm.
A combination
Okay,
of both, depending on the person and depending on the issues.
got you.
Because we're talking about things generally, and it's hard when you talk about things generally to kind of go deeper into specifics unless you know the specifics of a particular person and what they've experienced and what their history is in that regard.
I know, I hear you. I just know that in as people of faith, there are a lot of people who question, because I think some people in the area of mental health say there's no treatment for certain behaviors. And then people of faith question that with God, all things are possible. So that is, I think, what the genesis of that question may have been. But I understand and I respect that you say we don't have enough time to go into that, um, unless you want to further, explore it. But I want to speak to another issue, just with the recent increase mass shootings in the US in the last month. Um, I think both of the perpetrators were in their teens. So my question to you would be, um, is there is there an increase of young adults having, well, before I ask the question, I like to layer it. Dr. Lisa's like, "Ooh, I don't like her and her layers." But I guess the first thing, there are some people who say, okay, that is just pure evilness. Then there are some people saying it's a mental health crisis that we're in. So my question to you, it would just simply be, are we seeing a rise in young adults having challenges with their mental health? I'm not going to connect it to those actual shootings. I'm just saying in general. Um, is there an increase with young adults and their mental health um, challenges?
I think there's always been mental health challenges with youth,
Mm,
um, across the layers of whether youth to teenager to adult. There's always mental health issues there. Whether it gets addressed, that's another thing, or whether it's talked about is another thing. I think what happens is in times of stress and distressing situations, it elicits a lot of the outward expression of what we see. I
mm,
think because of the pandemic,
mm,
we've seen an increase because certain behaviors are more noticeable because we are seeing them with, for if we look at the child age range, because they're at home with us. We see the behaviors that we may not see if they were outside of the home or in the school setting or in their normal day to day because we're not focused as much.
mm,
So it gets highlighted more. I think the pandemic has also helped us to see that depending on your child, what type of student they are, what type of learning environment they need. It also shows us what their personality is like, how they survived under that stress
mhm,
of just having to go from what was normal to not normal to a new normal,
mm,
and how they were able to tolerate or not tolerate those changes and ongoing changes with that. For some, if you're introverted, being at home during the pandemic was wonderful because I don't have to be around others. If
yes,
you're extrovert and you need energy from others, then it's like,
it was
I'm
horrific.
dying. I'm
Yeah.
depressed because I'm not connecting with others. And no, social media doesn't do it. I need physical presence, being in your space. So that can, all of these things probably have allowed, this whole pandemic has allowed people to see what may have been there already or what may not have been there but has been born of the situation and how people deal with stress and
Mm,
deal with change, and if it's familiar, unfamiliar, or what coping skills they have or don't have. So it, a lot of it's born of our environment, and we do see an increase in a lot of these things.
awesome. So I guess how can we, parents, just individuals, how can we better recognize if someone we love or someone we work with is having, just because I guess even I have heard in some of these interviews how the parents would be like they had no clue, or it just takes loved ones by surprise sometimes, whether it's death by suicide or whether it's harming someone else. So whether they harm themselves or someone else. So how can are there any specific signs to look for in the home or on the job to kind of
Okay, there are a number of things. I think there are always clues,
okay, this is good.
but are we really tapping into those clues? Are we, I
Oh, the
think sometimes for parents, if we look at it from what you started with, if we look at parents, we can be present, but sometimes we're not emotionally present. And sometimes we may miss things that our kids say because if it's something on your child's mind, it will come up in different ways. But you have to be listening, actively listening to catch it. I'm not saying that we have to be investigators and be on them and, just what are you doing? How are you feeling? All this, because that can shut a child down. Communication is so key with kids. And if you have that rapport where you're able to talk, and share some things, then you're able to get things out. If you know your child and know their ways and their mannerisms, you can tell, okay, little Johnny is acting differently. Let me just monitor it. Let me see what's going on. Not saying that we're trying to create a problem, but if we can see there's a shift. If you normally goes to bed at 9, now he's staying up till 1 o'clock in the morning. He's not getting up. If he doesn't want to go to school where he used to love school, there are clues that talk about it. If we see that maybe the child is more, if the child is depressed, for example, if they're kind of staying to themselves in the room. Some of us think that, oh, they're just a preteen. Oh, they're a teenager. They want to be by themselves. They don't want to be bothered by us. Is that really the case? Or are they isolating? Are they withdrawn? Are they going through self-esteem issues? Are they cutting? Are they, what is going on? Because we're just ruling it out as, oh, that's teenager behavior. So that's why communication is key, to kind of know, hey, we have some type of communication. We have a way to connect. I know how little Johnny normally is. I don't see him that way. Something's going on. Let me just keep my eyes open. Let me see if something else is going on there.
So, would you say that the clues are pretty much easy identifiable in adults as well? Or not, I wouldn't say easy identifiable, but they're there. And if we look close enough, we'll find them in adults.
Well, I guess for maybe as a trained eye, I can see it easier. But I mean, they you that's why we have to be present again. You have to check on
Mhm.
those that we know, especially the quiet ones.
Mm.
And so,
Because
or even our more vocal ones, because sometimes we can put on that front that everything is good. And we're good for doing that as islanders, as women. We kind of wear so many hats that we're good to kind of just, hey, I'm good. Keep it together for the day. Once I get home, I can have that emotional letdown and be my depressed or anxious self or whatever I'm going through emotionally. But through the day, I put on my makeup, I put on my cute clothes, and
yeah.
I'm good.
So when we suspect or see that there's something going on, how do you recommend we approach that person to say, hey, maybe you should get some help, or how do we go about that? Just, that sometimes is very, very
It's a
difficult.
very difficult thing to do, especially if the person is not opening and welcoming to
Yes.
someone coming into their space and saying something's wrong with them, or you need help.
Yes.
That's where you have to know the person a little bit as to who you're approaching, and be willing, if it's really something that you see that's glaring, hey, I'm here for you. Disarm them.
Something as simple as that is the
Hey,
crack.
I care. If you need someone to talk to, hey, let's grab some coffee.
Yes.
Just nothing to kind of, because our automatic reaction is to be defensive. We put the defenses up
Yes.
sometimes, and then that shuts us down, and then we get nowhere. But we have to find a simple way to just, maybe it's just a touch on the hand or something, or maybe if it's just something that you rest on their desk and say, I'm thinking of you, or hey, it all depends on your environment and the person and how you approach them. But if you see that there's something glaring, you don't want to leave that person without any supports, because people are lonely. People are going through things, whether they show it or not. And we have to take that initiative sometimes to just say, I'm here. I
Awesome.
care.
Awesomeness. So we're almost done. I want to ask two questions. As a lot of people who listen to this program they're people of faith, and I know sometimes with people of faith, um, the when it comes to mental health, it's like, okay, let's pray, and we can pray whatever the situation is away. Um, there are some people, if there are recommendations for medication, they'll be like, no, let's just treat it the natural way. And not just people of faith, just some people in general. What are some of the benefits of, or
1 o'clock.
there's certain, I'm sorry,
Go on.
are there certain mental health challenges that can be treated in a non-medical way, and others that definitely need medical intervention? Are there some that we can just pray and, will go away, or are there some that definitely, yeah, require that type of intervention? I see a question coming in, but you can answer that, please.
Well, the scriptures say faith without deeds is dead. So if you have faith and you're praying, yes, prayer is good. You need to have your support system, and you need to know where you draw your strength from. So if you
Yes.
draw strength from God, yes, draw your strength from God. But then don't be blindsided, or don't n- not get help because you're going to feel that God is faithful, God will take it away. Yes, God is helping you. Yes, He's giving you the strength, but also maybe depending on the illness, you need help. You need something else to help you get through it, and to be open to that. Um, for some who are adamant against getting medication, or adamant about, seeking help, you need to really reflect on that and say, okay, what am I dealing with here? Do I know what I'm dealing with? Am I open to going to a therapist? For some people, it's going to a therapist, talking through the situation, getting an understanding of it. It doesn't lessen your faith. Find a therapist that has a spiritual background, so that they are aligned with your belief systems and know what's going on with you from that perspective, and be able to guide you. Um, if you want to do natural, then okay, let's talk about that. Do some treatment goals to say, let's look at the natural ways of doing it. Are you actively going to use coping skills? Are you actively going to use strategies that we talk about and apply them to try to see the benefits of them? If we see that we're not getting any success there, and it's impacting your daily functioning and your life, day to day things that you have to do, then maybe let's consider having a consultation with a psychiatrist. Having a consultation doesn't mean you're buying into getting medication and you're going to go down that path, but at least you're making an informed decision about what you want to do with your care. For
Awesome.
some conditions like depression, like anxiety, you may need something to just calm it, because it is a chemical imbalance. It is something that's going on with you, that you, by using the natural strategies, it's not helping. You need that extra piece. And there's no weakness in getting that. And you have medication, but you're not just giving the medication, say, hey, take the medication, you'll be fine. No, you continue to have the therapy, you continue to have medication consults, so that you are able to be successful, because you're building the skills to help you when you go through those low lows if you're depressed, or you help yourself when you're feeling anxious or having a panic attack. What I need to do, those strategies, so that you are balanced. I mean, you think of a plane, you can't just fly with one wing, you need to have it both balanced. So you have, medication, with your psychiatrist, you have your therapist, and you're learning the skills. You're not just putting a band-aid on it if you just get medication. You're doing the work to kind of help yourself to improve and to grow in the strategies you need to be balanced. And for some, it may mean taking medication. For some, it may be making taking medication for a spin for a little bit of time, but you don't know that until you start looking and going down that path. And then you always apply your faith. It's like, God, show me and help me what I need to do. Put the people in my path to guide me and advise me in the right way.
I love
So it's
it.
a
I love,
balance.
I love how you're saying balance. I love how you're saying stay open. A lot of times we just close ourselves off. We don't want to hear anything. And some of the comments, I love that approach, just a soft, gentle letting them know that you are there and care. I think that was speaking to the first
Mhm.
to the question before the last one. Then another one: physical health and mental health should be viewed in the same manner. Exactly. And I find that so interesting. Many times we're concerned about our physical health, we're concerned about every health, we're concerned about financial health, but we don't understand that when the mental health is off, like you say, not in balance, it negatively impacts all those other healths, our
Mhm.
physical,
Mhm.
our
Mhm.
spiritual, our relational health, or our relationships. Someone said God provided professionals exactly to assist in the healing process, even when we pray. Excellent. Um, Someone is saying yes, indeed. Awesome. Last question. I'm going a little over. So the final question, I thank you so much. But the final question, what are some basic steps that we can do on a daily basis to start protecting our mental health, or to improve our mental health? Just simple, basic steps that you would give us before you go on how to protect our mental health and or improve?
Okay, so I have some takeaways then.
Yes,
Be grounded. Whatever higher power you believe in, that power, pray, meditate, connect with it daily, read your Bible, do
yes,
yoga, whatever that is, be grounded. Be
grounded.
informed. Don't stick your head in the sand. As scary as it may be to go through what you're going through, you need help. Don't, it will impact you whether now or later. So, it's okay not to be okay. Accept that, understand it. It doesn't make you weak. It makes you stronger to know that there is something and I need to deal with it. So empower yourself in that way. Know
Yes,
your limits. Know yourself. Sometimes we go about our day, we don't want to be introspective. We don't want to kind of take that internal look and be mindful as to what's going on with us, because if we slow down, we feel like we're going to fall apart. But we need to know our limits. We need to be introspective. Take that time to know yourself. Create routines. We need routines. We need structure.
thank
We can
you.
be
That's
all over the place
ah,
and feel like we're doing things and not going anywhere and not getting
yes,
anything done. So, no routines. Find time for yourself. We have busy lives, whether you're busy or not busy, find time for yourself, find a hobby, be out of your head, do things that make you smile, do things that bring joy to yourself. Stay connected. Loneliness, before the pandemic, the Surgeon General was talking about loneliness as being a pandemic, that people are lonely. Be intentional with connecting with others. Be connected. We need each other. Whether you think you need people or you don't, you do. You do. Exercise,
don't think anymore. Just
you,
know that you do. You
you
need
do.
it. Mhm.
Exercise, it gets the natural endorphins going. It makes you feel better. It gets you moving. It keeps you healthy. There's such a correlation between physical health, lack of sleep, and mental illness. So
Mhm.
take care of yourself, exercise. Feel good. Practice mindfulness, what I talked about. Mindfulness is just basically uh, being present in the moment, presence with what's going on with you, with using all of your senses, doing that emotional self check, like ground yourself. What am I thinking? What am I feeling? What am I taking in? Just being aware, because sometimes we can be so disconnected. So just being aware and being present.
Yes,
Get outside, let the sun hit your face, get some fresh air, change. Sometimes we can be so stuck inside, especially with COVID's not going anywhere. We just need to learn how to deal with it and be wise and safe. But we can't, just stick ourselves in the house. We need to let the sun hit your face, get some fresh air,
fresh
and
air.
then make some goals for yourself. I know we think about the new year as being the time that we make goals, but no, continually make goals for yourself, continually check in with yourself. What am I doing? Where am I? We want to be proactive versus reactive, and sometimes stretching ourselves a little bit and setting some goals, thinking about the end in mind, which is one of the habits of highly effective people, kind of gives us something to kind of look forward to. Be reflective, journal. Don't let yourself get stuck in your head. And one other things that we can do is make a gratitude list. Just we can be very negative as a culture, as a community, in general. Our valences towards negativities most of the time, and we have to fight that. We have to change our mindset and reframe it. So a gratitude list will help you hold on to the positives when you feel there is no positive, when you feel there's something going on and you can't get a grasp of it. And when you need that light at the end of the tunnel, focus on the positives. A gratitude list. And don't let yourself be defined by a label. If you have a mental illness, don't let it define you. There are so many people thriving that have mental illnesses because they're learning to take control of it and not let it control them by getting the help they need. And
Ex-
celebrate you. Be encouraged, motivate yourself. Remember, it's time to get yourself back. We can't get back time, so don't waste it. Enjoy the journey. There are going to be highs, there are going to be lows, there are peaks, valleys, but make it worth it for you. And by that, take care of your physical, emotional health.
Excellent. Wow, this has been, I mean, I wish I had, because I love to take notes. And as you
Mhm.
were just riddling them out, I'm like, oh man, I wish I had a pen. But anyway, it's recorded. So I'm going to go back and just be, but
Mhm.
this has been an excellent hour. Sorry for the layered questions.
That's okay, and I know we went all over the place, so hopefully
Oh,
everyone that's listening got something out of it and it wasn't too confusing. And, if you have more questions about the things that we were touching on, because there are a lot of layers to mental illness, to get the help, to seek it out, and to
yeah.
really put the professionals that do this on a daily basis, seek them out.
Excellent. And is there any way somebody maybe in the DC area, because I have people who listen to this who are in that area? I don't know if there's any way they can reach you except for what I said earlier. Your practice is again?
Green Spring Psychological and Consulting Services. I'm on Instagram at um, Green Spring Psychology. So you can find me there. And Green has an E on the end. So you can find me there. And you can also find me when you do a Google search. I pop up.
Yes, and remember too, she is also a life coach. She's a motivator. As you can see, she motivated me. She's also, yes, so she's not just the clinical psychologist and therapist. She's a motivator, life coach. And I forgot to mention at the top about your sorority. I'm sorry.
That's fine.
Yeah. Yes, but so I am just so happy. And here we try to just remind people about the greatness, and to tap into the greatness that God created them, to be great, all of us to be great.
Mhm.
And we cannot be great unless our mental health is in a good state. And so I just thank you, thank you, thank you. Let me see if there are any more questions. Oh, Alea said definitely got a lot out of it. So even though we were all over the place, she got some stuff.
I'm
And
glad.
it's okay to be all over the place sometimes, just touching on little things. But if there are any other questions, anybody in the chat, if you have any questions, you can throw it in before we sign off. But if not, I'm just going to say thank you so very much. Can never hear enough about, okay, we have a comment saying, can never hear enough about mental health. An hour well spent. Thank you so much. Okay, so this is what we're getting back. So thank you, thank you, thank you. Really appreciate you being here. You cleared up a lot of stuff, and I'm one. After it's done, I'll go back and I'll process, and I'll be like, "Oh, okay." So I'll get my nuggets probably when I listen when I listen to it. But thanks again, and I'm just reminding everyone, greatness is in you. You have great things to do, so go and be great. Thank you, and have a beautiful week.
Thank you
Good
for having me. Good night.
night.